Tinnitus is the perception of sound, ringing, buzzing, hissing, or roaring without an external source. It affects roughly 10 to 15% of adults and can lead to sleep disturbance, concentration problems, and emotional distress. Western medicine perspective. Clinical presentation. Subjective tinnitus, heard only by the patient, accounts for approximately 90% of cases. Objective tinnitus, which is audible to an examiner, is rare and often vascular or muscular in origin. Anatomy and physiology. Outer and middle ear. Sound waves strike the tympanic membrane, vibrate ossicles, and transmit to the cochlea and hair cells. Inner hair cells convert mechanical energy into neural signals. Outer hair cells amplify sound. Auditory pathway. Signals travel via the cochlear nerve to brainstem nuclei, inferior colliculus, and auditory cortex. Tinnitus mechanisms. Cochlear damage. Hair cell loss reduces auditory input, triggering central gain increase and phantom sounds. Neural hyperexcitability. Maladaptive plasticity in auditory cortex and limbic areas perpetuates perception. Standard management of tinnitus involves several approaches. Hearing aids and sound therapy can help mask the tinnitus and downregulate central gain. Cognitive behavioral therapy, or CBT, addresses the distress caused by tinnitus and facilitates habituation. Although there are no FDA-approved drugs specifically for tinnitus, pharmacotherapy may involve the off-label use of antidepressants or anticonvulsants. Emerging treatments like neuromodulation, such as bimodal stimulation and hyperbaric oxygen therapy, are currently under investigation. From a traditional Chinese medicine perspective, tinnitus is seen quite differently. It's considered a reflection of an imbalance within the body's yin, yang, qi, blood, or essence, all affecting the ear's orifice. In traditional Chinese medicine, or TCM, tinnitus is understood as a sign of imbalance among yin, yang, qi, blood, or essence. The key etiologies include several conditions. Some common Chinese medicine patterns for tinnitus are liver kidney yin deficiency, where insufficient fluids fail to nourish the ears; liver fire or yang rising, which leads to hyperactivity and produces sharp ringing sounds; qi and blood stagnation, often due to trauma or stress, impedes proper circulation; phlegm heat obstruction, where turbid phlegm blocks the clear orifices; and finally, kidney essence deficiency, which could be due to congenital weakness or age-related decline. Pattern diagnosis relies on a professional TCM doctor evaluating a patient's tongue, pulse, and abdomen, determining the level of heat, cold, and fluids or fluid deficiency in the different body systems that contribute to the symptoms. Traditional Chinese medicine offers various treatment modalities, including acupuncture, herbal medicine, and other traditional practices. Acupuncture, a key component of traditional Chinese medicine, has shown promise in treating tinnitus. Local points around the ear and that affect blood flow and nerve signals to the ear are used. They are relatively painless. Scalp acupuncture may be used, and sometimes electrical stimulation is implemented. These tell the body to focus on the ears and head. Additionally, distal points that address the patient's underlying pattern are selected to balance the body's energy and fluid distribution. Patients often see improvement in body systems they did not recognize as related to their chief complaint. Moxibustion, particularly warming Ki3, supports kidney yang and enhances the treatment's effectiveness. Clinical evidence suggests that 78.6% of systematic reviews and meta-analyses report positive effects on tinnitus-related outcomes, although the quality of the studies varied. A recent trial demonstrated that acupuncture combined with moxibustion significantly reduced tinnitus handicap inventory scores compared to the control group. Typically, a treatment course involves 2 to 3 sessions per week for 4 to 6 weeks, with point selection adjusted based on the patient's response. Chinese herbal medicine offers several classic formulas for tinnitus. Long Zuo Ci Wan tonifies the kidney and calms liver yang, while Tian Teng Yin pacifies liver wind and clears heat. Bushan Huo Shui Tong Luo is used to tonify kidney essence and invigorate blood, and Chai Hu Jialong Gu Mu Li Tang harmonizes Xiaoyang and sedates Shen. Key herbs include Ginkgo biloba, which improves microcirculation, but has shown mixed results in randomized controlled trials. Gastrodia elata, or Tian Ma, extinguishes internal wind, and Rehmannia glutinosa, known as Shu Di Huang, nourishes yin and blood. Clinical evidence indicates that adjunctive herbal therapy alongside Western treatments provides added benefits in small, randomized controlled trials, though larger, high-quality trials are needed. The typical treatment course lasts 4 to 8 weeks per herbal cycle, with formula modifications as the patient's pattern shifts. The true efficacy of herbal medicine is in the customization to address each patient's underlying pattern while targeting the ears as a place of concern. Unlike Western medicine, a Chinese herbalist will never prescribe a single herb, but constructs a balanced formula that addresses all the patient's organ systems while bringing focus to their main concern. It is for this reason that trials and studies are truly not representative of Chinese medicine's efficacy. Research on acupuncture shows positive effects on secondary outcomes like the Tinnitus Handicap Inventory and Tinnitus Severity Index. However, there are insufficient high-quality randomized controlled trials to draw definitive conclusions, as you cannot conduct a Western model study by treating each patient individually. This is an inherent challenge in trying to view holistic medicine through the allopathic lens of Western medicine. Herbal medicine, particularly Ginkgo biloba, has conflicting results, while modified TCM formulas show promise in preliminary trials. Combining TCM modalities with conventional interventions may enhance symptom relief and improve quality of life for tinnitus patients. A practical treatment framework for tinnitus includes several steps. First, a thorough TCM pattern differentiation is conducted via tongue, pulse, and history assessment. Next, an acupuncture plan is established, with sessions 2 to 3 times a week, and acupoints adjusted per session. Herbal protocols involve 4 to 6 week courses, tailoring formulas to the patient's evolving patterns. Outcome monitoring is essential, using tools like the Tinnitus Handicap Inventory or Visual Analog Scale every 2 weeks. Finally, lifestyle support is crucial. Patients are encouraged to follow a yin-nourishing diet, including soups and cooling foods, and to engage in stress reduction practices such as qigong and meditation. For advanced acupuncture and custom Chinese herbal medicine in San Diego and Oceanside, California, visit Michael Woodworth at Makari Wellness. With 20 years of experience, he offers personalized treatments to help you achieve optimal health. Learn more at www.makarywellness.com.